this section, we will discuss the various techniques for treating BPD. We will focus on the experiential techniques, which are directed towards the feelings. They have an important role in treating BPD with the schema therapy. Most of these techniques can be used in the current situations as well as with the experiences from the patient's past. The first experiential technique is imagery. Imagery, as we can gauge from its name, has something to do with the images and the visuals. In this technique, the patient tries to recreate a certain situation in her mind. While creating this imagery, she experiences what took place during her interaction with others and what her emotions were. Mostly, these are the situations which led to formation of her negative schemas. Now, obviously, the therapist cannot go back in the past and change what happened or how it made the patient feel. What the therapist can do is to create the exact visual in the patient's mind and then alter it or rescript it. Rescripting means changing or altering the imagery. It is done later when either the patient or the therapist feels that some aspect of the situation must be changed or altered. It can be done only after a safe therapeutic relationship has been formed between the patient and the therapist. This technique is used in certain situations, such as when patients' emotional, physical, or developmental needs were not met, or any kind of abuse took place, or the patient's autonomy and expression of emotions were restricted. Apart from this, when patient had to take care of her parents or her siblings, this is known as parentization. The most important goal of this technique is to make the patient understand that it is the situation in which she was raised that was wrong and not her. This is important because the patient thinks that she is wrong or she might have done something wrong to deserve how she was treated. For example, if in childhood the patient's mother criticized her on everything, then she may think that she might have done something wrong and that is why her mother is scolding her. Another important goal is the emotional processing of the traumatic events. When the traumatic events are emotionally processed, then the schemas that the patient has developed based on these inadequate experiences are slowly replaced by the healthier schemas. In this technique, the main focus is to change the situation in imagery, and while doing so, the exposure to the most traumatic moments is kept to a minimum. Imagery rescripting helps the patient to become aware of her own feelings and needs and learn better ways of dealing with them. She also starts to ask for help and support from the people she trusts. By using this technique, the abandoned child can be made feel safe, protected, and comforted. The punishing side can be neutralized. The angry child can express her rage about the violation of her rights, and the healthy adult can learn when to take action when she sees a situation in which the child was improperly treated. Imagery rescripting sometimes leads to surprisingly quick change, but it has to be used repeatedly with the different situations and different memories to ensure a long lasting change. In this technique, the therapist asks the patient to imagine a safe situation first. It can be a real place where the patient has been or knows of, or it can be a fantasy place. If the patient does not know any safe places, the therapist can make suggestions such as a place in nature or another place where the therapist thinks that the patient will feel safe. Now, why does the therapist begin with creating a safe place? This is done so that the patient can get used to the imagery while at the same time she can return to it if any other imagery exercise becomes too intense or evoke unpleasant emotions. It may happen that the patient is not able to imagine a safe place, then the therapist must not pressurize her and should continue ahead with finding a negative childhood memory. And when she does so, she explains the memory and how it made her feel. Then the therapist asks the patient to hold on to how it made her feel and let go of the memory. Then she is asked to hold on to the feeling and let other situations which made her feel in the same way come in. The patient doesn't have to actually look for the memory, it should come on its own. When the patient recalls the similar memory, the therapist asks her to come back to the safe place she created earlier and open her eyes. It is in the later stages of the therapy when the therapist expands imagery from finding a connection between the current schemas and the past events to the rescripting of the memories that led to formation of the dysfunctional schemas. This is done to change the meaning that has been assigned to the past memories. The rescripting is done in two parts. There are two phases in the first part. In the first phase, the patient recalls an unpleasant memory from her past in as much detail as possible. It is not important to recall the memory just as it happened because the purpose of this is to change the meaning of schemas of the patient's childhood. When the patient recalls the memory, the therapist continues to ask about her feelings and experiences. The therapist inquires as to sensory experiences. For example, what do you see, what do you hear, smell, or feel? The emotions, what do you feel? Are you angry or frightened? And the thoughts, like what are you thinking now? And the behavior, what are you doing, what is happening, and so on. Once the memory is clear, one may proceed to the phase 2. It is unnecessary to relive the entire memory. It is enough that the patient experiences the emotions that were attached to the situation or the memory. For example, little Nora tripped on the stairs and hurt her leg. Instead of tending to her, her mother started scolding her and told her to stop crying. She instead inquires if she broke something when she fell off the stairs. She tells her mother that she knocked off a vase while tripping. This angers her mother and she takes a step forward to slap her. The moment something serious threatens to take place in the imagery, the therapist stops the situation and says that he is there to help little Nora. He asks the patient to imagine that he is in the same place with her at that moment. Then the therapist does everything to protect Nora and to comfort her. He stops the attacker and sends him or her away if that is required. Continuing with the example in the phase 1, the therapist enters the room and stops the mother from hitting the patient. The patient feels that her mother is angry, but she will not hit her as long as the therapist is present there. Then, to eliminate the threat and to make Nora feel safe, the therapist sends the mother out of the room. Once the attacker has been sent away, the imagery continues. Little Nora also needs support, comfort, and care. Just as a good parent cares for his child, the therapist must also do the same for the patient. He would speak in a reassuring tone or a manner that is comforting to the patient. The patient experiences this moment as a young child and she will find this very normal. If the patient feels scared, then the therapist may take her to a safe place or to the place of a caring relative. Once the patient has been taken to a safe place, the therapist stops the imagery and discusses the meaning of the schemas. In many cases, the patient has already concluded that everything was her fault and her parent had the right to be angry with her or mistreat her because she was dumb or bad child. By rescripting the situation, the patient becomes aware that she was not wrong and she did not deserve the mistreatment, but rather she was a small child who was in need of care and that her parents did not do things that a normal parent would simply do. By using this technique, her self image, which tells her that she is a bad or a lazy child, can be adjusted. Whenever possible, an alternative interpretation can be formulated and the patient starts to feel about herself in a healthier way. For example, I wasn't guilty of the situation, but rather my mother should have kept her hands to herself. And I feel relaxed and not nearly as scared as before. With this, we move to the second part of the image rescripting. Second part of the treatment starts when the patient has developed healthy adult mode and can herself execute the rescripting. The phase 1 is exactly the same as we discussed in the part 1. In phase 2, the rescripting is done by the patient herself. The therapist asks the patient to imagine entering the situation as a healthy adult. The therapist continues to ask the patient about her feelings and thoughts from the healthy adult perspective, what she thinks should be done for the little child. This is far more effective for her self confidence when she makes these decisions for herself. For example, in the situation that we have been discussing, this time Nora enters as a healthy adult to help little Nora. Even though the mother is mad, Nora is stronger than her and she helps little Nora in sending her mother away and even tends to her emotional needs. One thing that can happen is that the patient can attain the healthy adult mode but is still unsure about how to proceed further. In this case, either a helper who can be a relative, friend, or the therapist can coach her by suggesting the things that what she can say. In the end, the therapist checks if the little child has received the support she requires in order to meet her needs and to integrate this new experience into her schema. The therapist asks the patient to close her eyes again and describe what Big Nora did and how it made her feel. He then inquires if there is anything else that she would want Nora to do. The therapist continues to ask these questions until all of the little Nora's needs have been met. In this manner, the patient can integrate new insights in her self image. With this, we have discussed what the image rescripting techniques is, but there are some problems that can hinder this technique, such as the patient does not close her eyes. Sometimes the patient cannot close her eyes because of the fear of being looked at or being judged by the therapist. She may fear that the therapist may do something unexpected. So, the reasons for not closing the eyes are explored, and then the patient can make suggestions to the therapist which would help her to feel safer. For example, even the therapist closes her eyes or physically moves away from the patient. The another problem is the inability to find memories. If the patient says that she has no memories from her childhood, It means that she consciously does not want to be reminded of these memories, or that she has buried them away and actually have difficulty remembering them. By using imagery to recall a pleasant memory, one can often recall some unpleasant situation. It may also happen that the patient does not want anybody to go against her parent or parents. Often, the patients are unable to act against the punitive parent out of the misplaced sense of loyalty. They are so loyal to their parents that they don't want anyone to make any remarks on her parents. In this case, the therapist must explain that the purpose is not to reject her parents completely, but to address the behavior, the problematic behavior of her parents that are related to formation of her dysfunctional schemas. Another problem that may arise is that the patient thinks that the intervention is wrong. It may happen that the patient may be dissatisfied with her own intervention or that of the therapist. In such cases, phase 2 can be repeated by using a different intervention. For example, if the patient wants to have Big Nora or the helper to beat her mother up as a form of revenge, but on second thought, she decides locking her away in prison is a better idea, then this can be changed in the imagery. The therapist can use the intervention, but the aim of the therapy is to protect the child. And the last problem that may arise is that the patient can feel guilty about not being able to stop the abuse when she was a child. It can be reassuring to explain to the patient what exactly the particular age of amount of child is capable of doing. By observing children in her direct environment, the patient can be made aware of just how small and young child of say 4 years actually is and how little control she has over her life and surroundings. The therapist can also use examples from his own childhood as a sample of a normal childhood. Imagery rescripting is a powerful tool to evoke changes in the patient's schemas. However, it is wise to plan the use of it during a prolonged period, once every 2 sessions. Imagery rescripting can be altered with the other experiential as well as cognitive and behavioral techniques is recommended.